Okay, so today I'm here to talk to you about and inform you about donating blood. One of the main reasons, or the three main reasons I'm going to cover, is why you should donate, who's the person taking your blood, and where your blood goes after you donated it. Why donate is one of the main questions people ask, and there is many reasons for it. The pros of donating blood is it can help save lives, which emergency cancer patients, any kind of patients, and most people eventually in their life will need a blood transfusion. On Inland Northwest Blood Center's website, you can go online and track the times that you donated, and when you do, every time you donate, you get more points that can go towards movie tickets, free ice cream, coupons, gift receipts, and that kind of stuff. You get to find out what your blood type is, and that's one of the most important, because when you say you go in the emergency room and you don't have information on what your blood type is, they can look it up, or you can tell them and they can find it easier if they don't have any O positive blood stored already, which is the universal blood type that everyone can have. You or a family member might need blood one day, which is very possible. According to the American Red Cross, one donation can help save up to 3 lives. Who needs the blood? 34% of people are cancer and blood disease patients. So that's for chemotherapy, people who have really thin blood that bleeds out a lot. 19% is anemia. 18% is surgical and burn patients. 13% is heart, stomach, and kidney disease. And 2% is trauma. Even though trauma is the smallest percentage of people who take the donated blood, it's one of the most needed. When people come into the emergency room after they get in a car crash, they don't have the time to find the blood they need, know that they have it, or know what blood type they are, as do cancer patients and people who are constantly getting blood and receiving blood. These are usually people who have never needed a blood transfusion before. So when they come in, it's really important that the hospital has O negative, which is the universal blood type, so they can just put it in the people so they can easily get recovered. And how they do that is they give you the blood through an IV. Who is taking your blood? A lot of people wonder who those people are. I right now am doing a trained phlebotomy course, and I'm the one that goes around in the hospital and draws from you when you're in the ER, when you're an outpatient, or when you're on med-surg. But the people in the blood buses when you donate are also phlebotomists. And a phlebotomist is highly trained. They have to do over 170 to 200 trained hours and have to draw on people before they're allowed to do it on their own. Training is really intensive, and they also practice a lot, especially people that are donating your blood or taking your blood when you donate. They have even more training than people that are just phlebotomists in a hospital. Blood drive needle versus standardized venipuncture needle. This is a standard needle. It's really tiny, and I'll pass that around. And the one that I'm passing around is an 18 gauge, or it's a 23 gauge needle, which is the most commonly used in hospitals and outpatients to draw. So 25, 23, and 21 are what we use in hospitals, and 18 and 16 and sometimes 19 are what they use to draw your blood when you're donating. And they are pretty big. Okay. And there's many places you can go to donate. Around here there's Inland Northwest Blood Center, and they're based out of Lewiston and they're based out of Spokane. Hospitals, usually Inland Northwest Blood Center holds a blood drive at either Gritman, Pullman, and they hold it at least once a week, and you can always go and make an appointment. And what happens to your blood is when you first go in the blood bus to donate, they're going to use a red tube and a pink top tube. And these two tubes have the additive in them that doesn't clot. And they're going to take these, and the lab is going to process them, and then they'll take this, and they'll also take your blood. So here's the 2 tubes that they use. And according to the Mayo Clinic, whole blood is the most commonly donated blood and the most commonly needed and used. And when you donate one pint of blood. And usually you have about 20 minutes to do it. But some places let you do it longer, it depends on. But you have to get exactly 500 milliliters because inside the bag is an additive that helps it from declotting, and if you don't have the same amount of the additive, then it's gonna clot and the blood won't be any good. So once they send the tubes that they took from you, they'll send it to a lab, and the lab will test it for any diseases or things that would make the blood not useful for you or for the patients you're giving it to. And it's just out of those 2 tubes, and then your pint of blood is going to be sent off and dispersed to different hospitals. And when they distribute it, they'll distribute it to hospitals, they'll distribute it to outpatient clinics, and there's also different blood places that store all the pints of blood. And any questions? Yeah.
What are all the different types of blood?
There is A positive, A negative, AB positive, AB negative, B negative, B positive, O positive, and O negative. Yes.
How many times have you given blood?
I've given blood 1 time, and it didn't work. Yeah.
Have you had any family members that have needed blood in the past?
Yes, my uncle had cancer, so he had blood transfusions a lot.
Do you know how long the blood, like after people give blood, it can be stored for?
It doesn't have a long shelf life, usually 2 or 3 weeks. It depends on how it's stored. But that's why it's another reason it's really important to give blood, because the shelf life is so short.
So they just keep replacing the blood?
How long can you give blood after you've given it already? So if I gave it last week, how long would it take before I can give it again?
You can give it again for whole blood in 8 weeks.
How long does it take you to become a certified phlebotomist?
It's usually a semester long if you're looking at college hours. You have to do 50 hours of classroom. This is what I had, and 120 hours of clinicals in a hospital.
How many years of schooling do you have to go to?
You don't have to go through any. It's like a workforce training, so it's just a course you take, like CNA certification, and it's just based on hours and how many draws you get.
As a phlebotomist, you said you're working in the hospital. Like, who do you draw on? Just everyone? Or?
Yeah, we'll go to the emergency room, med surg, on the floor, outpatients that come in that need their blood tested and sampled. It's almost everyone in the hospital.
Do you want to be one of the people that are in the buses, or do you want to be in the
No, I
hospital?
like being in the hospital.